Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
That's going to be a new patient. It is a patient that has not had professional services face-to-face with the patient, with the physician. Now, a professional service is an E&M type service as opposed to what we see a lot of times with pulmonary or cardiology, where they're interpreting results of a test. They're not giving a face-to-face opinion, having an E&M visit. They're rather just interpreting a test. So even though your office may have a chart, even though your office may have the information in their billing system, that particular patient was not seen face-to-face for a professional service. Now that concept has always been there. But the part that they changed is the next bold words that you see, that it is professional service from a physician or another physician of the exact same specialty and subspecialty that belongs to the same group. Why that differentiation? Well, the way it was explained, and we get information at the AMA meeting in Chicago every November, it was explained for things like an EP physician in a cardiology group or a hand surgeon within an orthopedic group. So it's exact same specialty and then subspecialty. Because remember, Medicare and other carriers look at a tax ID and how many of the physicians are of the same specialty or subspecialty by provider type. And all those physicians are looked at as one physician when we look at care things. So now they're saying exact same specialty, exact specialty and exact same subspecialty. It gives it a little bit different meaning and opens the door to physicians with additional expertise to potentially bill for new patients within that same group practice. Now, you're going to have to talk to your carriers to see how are they going to differentiate this doctor that you have in your practice that is not of the exact same subspecialty. For example, in a pulmonary office, if you have a doctor that's doing just sleep disorders, there is no specialty code for sleep disorders, so they would all look like pulmonologists in that office. Does that now mean the sleep physician can bill a new patient because they are not of the exact same specialty and subspecialty? Those are questions we're waiting to see practically how it happens, and you can contact your carrier to see proactively. We see some of the same information when they look at the definition of an established patient, and also a reference to our Decision-Making Tree, which is now back in the CPT book, which we see on slide number 5. And if you follow that Decision-Making Tree, you know, if we have a patient that has seen someone in the practice in the last 3 years, yes. Is it the exact same specialty? Yes. Is it the exact same subspecialty? And again, that's the Decision-Making Tree, and that's right out of our CPT book in the front, again, in those green pages. So that definition of new patient we've got to look at, because that's lost revenue if you're allowed to bill a new patient and you're billing established. So it's worthwhile to check into. Still looking in the E&M section, they have added time to the verbiage for initial observation care. If we go back a little bit and remember when they first came out with, for example,
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.